I sought out support from my healthcare provider to ask for some help with, hey, I'm questioning the birth control as a piece of this puzzle. And I'm concerned about a transition off. Is there anything I can do to support my body? She essentially laughed in my face and told me, go off the birth control pill if you want to or don't. And I'll write you a prescription for plan B. That was her response. And I was horrified, so upset. I remember leaving that appointment in tears.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Jillian, welcome to the podcast. I'm really happy to have you here today.
Thank you. Thank you so much for having me.
How are you?
Awesome. I'm good. How are you?
Good. I know you're a functional dietitian and women's health specialist, and you have your own company, Jillian Greaves Functional Nutrition and Wellness. You really help women identify and address the root cause of their hormone and digestive health issues. You take a natural approach to this, which I love. I do the exact same thing. You do testing, personalized nutrition, lifestyle interventions, like all the stuff that matters, right? And
Yes.
I know that you do have your own story and journey into how you got into this. I think that's how anybody does, honestly. Anybody in the more natural, holistic realm, nobody woke up and just decided to do it. We
Oh.
all have our own story. I love just hearing everybody's story because there's other people out there who are experiencing this stuff and probably feel like they're so alone. I did at one point. Please tell me what got you into what you do now.
I love that you asked this question and mentioned this because I so agree. Anyone, I feel like in more of the holistic health space, it's what's your story? What was your struggle that brought you to seeking out alternative forms of support? So,
Yeah.
my story kind of has a professional angle and a personal angle where, from a personal perspective, I dealt with a lot of my own hormone issues. Specifically, I had spent over a decade on hormonal birth control, was put on hormonal birth control when I was in my teens
Yep.
and for painful periods, miserable periods, and went on it, took it for over a decade and didn't really think twice about it.
Yep.
And at this point in my life, I was in a really busy phase of life in terms of I was in grad school getting my master's in nutrition. I was working full time in a nutrition research clinic. I was applying to dietetic internships to become a registered dietitian, and I was burning the candle at both ends. I was also eating predominantly a plant-based diet. I was running half marathons. I was doing HIIT training 5 days a week,
Yeah.
and I started to experience a lot of symptoms. So I was noticing a lot of anxiety. My skin was breaking out. My hair was thinning. I was bloated. And at the time too, I had an undergraduate degree in nutrition. I was finishing my master's, had a lot of education, and I felt like, what the heck am I missing here? I'm on paper doing all the healthy things.
Yeah.
So I sought out support from conventional providers who essentially tossed me around from one provider to the next. Oh, I forgot to mention too, which was one of my biggest symptoms. I was dealing with really, really gnarly eczema, and which was just really uncomfortable, really frustrating. So I'd see a provider and they'd say, "Oh, here's a topical steroid for the eczema. Oh, you're anxious. I'll write you a prescription for anti-anxiety meds. You're the picture of health, essentially. Your labs look great. Meanwhile, I'm wildly
Why are we the same person? Why do
right.
we have the same story?
I'm wildly symptomatic,
Yeah.
and I was not willing to accept that. And so I started to dive deeper and was definitely assessing my nutrition and lifestyle habits that I thought were healthy at the time. And I started to really explore the birth control pill and question, what is this pill even doing that I've been on for over a decade? And I want to preface this conversation by saying I am by no means anti medication, anti birth control. Ultimately, these are tools. And I always want women to have the autonomy to make decisions around these things that feel best for them.
Look, I literally say that all the time.
I
And
love
like,
that.
I love that you say it too. I'm just like, okay, like automatically being in like a holistic realm, it's we're gonna be best friends.
I
So much in
know.
common, like with anybody going through this. But yeah, I like to say that too about medications. There is a time and a place.
Yeah,
Just because they've gone to school doesn't mean they know you the best. Like we might have the knowledge of what things are. And yeah, you should utilize that. Go to them, ask the questions, but then make your own decision.
exactly.
So I love that you
Exactly.
pointed that out.
Yeah, and I never want there to be shame or judgment, and ultimately, I want women to feel empowered and to be able to make informed decisions, which I felt like for me personally, and what I see a lot with clients is that they're not always given all of the information to be able to make those informed decisions, where admittedly, as someone in the health space, I learned nothing about female physiology in any of my training. And I didn't really understand even the mechanism of action with birth control and how it shutting down the reproductive system or any of the potential side effects. And so I sought out support from my healthcare provider to ask for some help with, hey, I'm questioning the birth control as a piece of this puzzle. And I'm concerned about a transition off. Is there anything I can do to support my body? She essentially laughed in my face and told me, go off the birth control pill if you want to or don't. And I'll write you a prescription for plan B. That was her response. And I was horrified, so upset. I remember leaving that appointment in tears. And that's what really catapulted me into doing a ton of research in terms of I need to figure out what the heck is going on, finding the functional medicine world and starting to seek out advanced training in functional nutrition specifically and women's health to better equip myself to actually support myself. So I had a really long healing journey, and ultimately it involved a lot of trial and error. It involved really significant changes to my diet in terms of the plant-based diet was not supportive for me. HIIT training 5 days a week was not supportive for me. There was a lot of things I was doing that was creating stress in my body that I thought was healthy. I transitioned off hormonal birth control, changed a lot with my diet and lifestyle, and over time was able to resolve all of these symptoms that I mentioned naturally. And that is what motivated me to seek out more training and to eventually start to support women, to really provide women with the support that I so deeply wished I had when I was struggling and I felt so isolated and like I had nowhere to turn. And that was really the personal aspect of things. The quick and dirty on the professional piece was that after I became a registered dietitian, I got like my dream job as an outpatient registered dietitian in a big Boston hospital in an endocrinology department. And I was like, I'm going to change the world. I'm so excited. And once I got into the thick of things, I saw a lot of what I had experienced myself, where so many women were coming with PCOS, endometriosis, thyroid issues. And it was very much a symptom suppression approach in this environment, a pill for every ill type approach. And it was so frustrating to see. And a lot of women too were recommended take the medication and go on a 1,200 calorie diet, right? And it just,
Yeah.
there was so much misalignment there and women weren't getting better. And that's what eventually really motivated me to start seeing clients privately. And once I was really seeing the impact I could have, I was like, I got to get out of
Yeah.
the conventional system and really do things differently.
Yeah. I want people listening to this to understand too that like you were trained in nutrition. That's what you were going to school for. And this was still going on. And you were applying what you thought were healthy habits, what you were learning. But even going to school for something in the health field, like you really only skimmed the surface. And providers who are continually learning things, always ongoing with their education, that's somebody that you want to be involved with, right? Because things are constantly changing and there's too much to learn in school. If this can happen to people like you and I who are studying these things and applying these things and going to school, and we're still looking for help and still experiencing this, that should be a wake up call to other people. Take your own health into your hands, and it can happen to anybody, really.
Yeah. Yeah, absolutely. And I think there was that study that had come out a while back that had found that it takes something like 17 years for new research that comes out to be integrated into guidelines that are disseminated in our conventional healthcare system, where that's something that also just didn't sit well with me in terms of like nutrition science, for example, is a very young science and things are constantly changing. And in my mind, as practitioners, it's our job to stay on top of this and to be able to adjust and best support clients with the knowledge and tools that we have, and not to be practicing like template medicine and perpetuating old outdated guidelines when we have new information available to help people better.
I like how you pointed that out too, because it seems like now, more recently, it's becoming more apparent that everything we were told, like in the early 90s, about like low carb and low fat, how big of an impact that's having on us. And if you think about it, I'm like, okay, like I was born in the early 90s, and I'm like, that's how long it's taken for people to realize, like for providers to start being more public and the research to show that that was causing so much damage, like all the low fat, you're not getting healthy fats, your cholesterol's messed up, your hormones are messed up. Like, why is it taking that long to
I
realize that?
know. And I still feel like there's and I want to be clear too. I don't think any provider perpetuating these outdated recommendation is like ill-intended in
Oh,
giving this advice,
no.
right? They think they're
Right.
providing the best advice at the time,
For
but we
sure.
still work with so many women that are coming to us where their provider who hasn't been trained in nutrition or isn't up to date on things is their lipids were a little bit elevated and they're told to go on that low fat diet still and cut out the saturated fat, the super low cal diets, the super low carb diets. And these are some really big issues that we see contributing to hormonal dysregulation in the women we work with.
Yeah, exactly. I was thinking back on my education. I went to nurse practitioner school and nursing school, and we didn't ever talk about nutrition. Nothing.
It's wild.
Like in the textbook or whatever, it would say, of course, step 1, focus on lifestyle and nutrition. But it didn't say what that was. And so then when you get in the real world, that's what you tell your patients, lifestyle and nutrition. And you go over like the basics, which is basically just what you hear on TV or what, but there's no real research behind what you're telling people because you never got that education. And even what's inside of vaccines,
I
you know,
know. I know.
they never, they just tell you to give it to them.
Yep.
Give it to them, and this is the schedule, but not what's in it. And then once I started thinking about that, I was like, "Oh my goodness, like, how messed up is that?"
It's so messed up. And I think it's a lot of people and women we work with, they're scared to ask questions, right? Because they're scared their provider is going to just dismiss them or gaslight them,
Yes.
which is that's my biggest issue where it's let's have productive conversations about these things and do our research and our
Mhm.
due diligence. And again, at the end of the day, we just want everyone to be able to make those informed decisions that feel
Yeah.
really good for them. But I think the way things are operating currently, it's really hard to do that.
Yeah, and to add to what you said, like, when I was working in clinic, I would have patients who you're only given X amount of time with them anyway, which is
Right.
ridiculous, and that was my biggest complaint because it's this person doesn't deserve 5 minutes, they deserve more than that for their wellness visit, and once a
Right.
year, they get 5 minutes, and then the people who would come in with a list of questions, which I appreciate a list of questions. They would be like,
100%.
"I'm so sorry, I have a list of questions. I'm so sorry." That was the best part of my day. I want to answer your questions. You know what I mean? But you could tell like how apologetic they were for asking questions, and it blew my mind. I'm like, "Please do not be sorry. Like, I'm proud of you for asking these questions."
That's why you're
That's what I
there.
like, that's what I'm
Yeah.
here for. But I don't know. I don't know where it gets misconstrued. But so a lot of women that you worked with and like your experience was dealing with PCOS, endometriosis. Tell me, what is the real why behind PCOS, the symptoms, and how to really reverse that naturally?
Yeah, I love that question. And, ultimately, for any of your listeners that aren't aware, so PCOS, polycystic ovarian syndrome, a really common metabolic and reproductive disorder. So impacts like an estimated 1 in 10 women. And it can drive a lot of systemic symptoms. So it's often talked about as predominantly a fertility disorder because it can impact conception and fertility. But
And
really,
Western medicine says treat it with birth control.
yes.
That's the Western medicine go-to.
Yes, it's you
Yeah.
have a PCOS diagnosis regardless of what your experience is. Birth control is the first line of intervention. And essentially, what that means is we're shutting down our own hormones and shutting down the reproductive system. And for some women, this might lead to some improvements with symptoms. However, it's a big fat band aid at the end of the day. And what happens when we want to come off the birth control? And it's what we see is so many women, they're thrown on the birth control. And then when they come off, it's, oh, maybe they want to try to get pregnant and it's, oh, let's push them into fertility treatment.
Right.
And that's the story that
And
in
now
the
there's
experience.
this rise in infertility now.
Yes, exactly. And so, in terms of PCOS, what I like to talk a lot about with clients is PCOS root causes or drivers, where there's a lot of different symptoms that women can experience, and really PCOS manifests differently in each individual. But a lot of these symptoms boil down to a few different core root causes or kind of imbalances or dynamics that we see drive the development and progression of symptoms. The big ones being blood sugar and insulin issues, gut imbalances, adrenal issues and stress, and chronic inflammation. Those are the four core things that we see playing the biggest role with PCOS.
Mhm.
And the really cool thing is that when you can investigate these things more deeply and identify what your root causes are or what your imbalances are driving PCOS symptoms, you can essentially put PCOS into remission. And for someone that's experiencing really significant PCOS symptoms and has had a long journey trying to navigate things, that statement might
Even Western medicine teaches that there's no cure. And we're not using the word cure here, too, either for anybody listening. But whenever you do put something into remission, it's like it's not there, but you're not putting a
exactly,
band aid over it. That's without the band aid. You're not having the symptoms being suppressed. You've completely put them on the back burner. So,
exactly.
and that's definitely possible. I agree though. It's very hard for some people to hear that.
Yeah. Yeah, because they've never been told otherwise, right? They're
Mhm.
told this is a lifelong thing and your options are medications, but there's, so much more to the story. And like both of us have seen in practice, it is possible to actually reverse your symptoms and to put them into remission. And we've worked with women that haven't ovulated naturally in years. And with the right support in terms of targeted nutrition and lifestyle support, we see women start ovulating naturally and ovulating regularly. And that's the overall approach that we take is treating each woman with PCOS very much as a unique individual with those kind of core root causes that I mentioned in mind and doing that deeper investigative work to understand what's going on underneath the hood for you and how can we start to support the body back to balance. With
Yeah.
one other thing I'll add here is that conventional recommendations for diet and lifestyle for PCOS, oh my gosh, right? You're laughing here because you
It makes it
experience it.
worse.
It
It
makes it worse. It
it makes
makes it
it
worse.
and I just have to say this. I'm not a conspiracy theorist. I'm not one of those people. But the more and more that I get involved in learning about what the human body really does and the root causes. And keep in mind, guys, I have been trained in Western medicine and functional medicine, so I can speak to it from both sides. But the more it seems like somebody is trying to do away with the human population because there's this
Right?
rise in infertility and we're not going to be having babies soon. Like, I have
It's
no words, but
wild.
I have all the words. It doesn't make any sense at
I
all.
know.
It
I
doesn't.
know. Yeah, it makes no sense. It makes no sense. And yeah, most women come to us again trying to do things that are healthy and supportive for themselves. And a lot of these strategies that they're implementing are working in direct opposition of what we want to achieve, which is
Mhm.
wild.
Yeah. So you mentioned like the four main like root causes behind like PCOS. I would love for you to just go into a little detail, like what that would look like for somebody. So like you said, blood sugar imbalance, thyroid issues, inflammation, and adrenals and stress.
Mhm.
So for somebody who's listening and says, okay, blood sugar issues, like I'm not a diabetic. Why does that matter? Can you speak to that a little bit?
Yeah, yeah. So when it comes to blood sugar and insulin issues, the large majority of women with PCOS experience some degree of insulin resistance. And essentially what that means is there's some cellular resistance to the hormone insulin, which is the hormone responsible for helping us to utilize glucose or sugar from the carbohydrates that we eat. So, when our cells are resistant to insulin, we end up with bigger swings with blood sugar than we would like. So, after we
Mhm.
eat, we can end up with big high spikes with blood sugar, and as a result, even big crashes and dips with blood sugar. And this is problematic for a few reasons. One, it can make us feel really crappy. So if our blood sugar is imbalanced, oftentimes we'll experience a lot of cravings, a lot of mood related issues, anxiety, energy dips and crashes, sleep
Yeah. Appetite
disruption.
crashes. Yeah.
Yep, those would be symptoms to pay attention to. But from a PCOS perspective, elevated insulin is going to directly stimulate the ovaries to overproduce testosterone or androgens, which can impact ovulation and the regularity of ovulation. It can also drive androgenic symptoms that women might experience with PCOS. So things like unwanted hair growth, head hair loss, cystic acne are some of the big ones. Big swings with insulin, specifically big spikes with insulin, can also drive more inflammation in the body. That's the blood sugar insulin piece of things. And what I will share too is whether you have PCOS or not, definitely with PCOS, supporting blood sugar
Mm.
is so foundational. But if you are a woman in general, if you're in your reproductive years, if you're in perimenopause, postmenopausal, blood sugar regulation is so foundational for everyone, even if your blood sugar labs look perfect. You can still
Yes.
experience dysglycemia and swings with blood sugar that can drive symptoms.
I was going to say too, for those listening, what she's saying is if our blood sugar is up and down all the time, that affects our hormones. So it does
Yes.
not matter like what stage of life we're in, ladies. Like you can't just be careless about what you eat. Like it's going to impact your hormones if you keep that up. But
Yeah.
also, a lot of times when we go to our yearly wellness visits or whatever, they check like our fasting glucose and our A1C, but they don't ever check fasting insulin. And fasting insulin is actually such an earlier marker of any kind of pre-diabetic issue than fasting glucose. Don't ask me why people don't check it. It should be because it can catch any kind of blood sugar issue, pre-diabetes, anything like that so much earlier. But
Yep.
a lot of providers don't check it. And that is just such a better marker too.
Such a better marker. And yeah, typically it's something you'd have to request. It shouldn't be
Insurance
hard
won't
to,
cover it
yeah.
because it would help them a lot faster.
And the other thing to note there too is conventional reference ranges for these labs like fasting insulin are really large and wide. Some they'll vary lab to lab, but you'll often see a normal fasting insulin is up to 20 or 25, but newer research has indicated that we really want to see fasting insulin below 7 and ideally between 3 and 5. So there's plenty of women that we work with that have come in and their fasting insulin is like 19 and they're like, "Oh, my doctor told me I'm fine and no issues with blood sugar or insulin." So that's something to keep in mind as well.
Yeah, gosh. And it's so much more too about, okay, there might not be anything alarmingly wrong right now, but don't you want to be preventative, you know?
Yes.
So yeah, that's very interesting. And then obviously thyroid issues, people struggling with thyroid issues, that's a whole other topic. I know we could
Yeah.
go on and on about that, but stress and how we handle our stress.
Yeah.
If you think about it, like the Lord did not make women to work 8 to 5 every single day. Like,
No.
come on, we
No.
need to sit down.
And from a stress and adrenal perspective, we know that many women with PCOS actually have more sensitive stress response systems and actually produce more cortisol at baseline and can have adrenal driven PCOS, where if we're under a lot of stress, and I think this kind of gets forgotten because PCOS is talked about so much as a fertility disorder, and we talk a lot about insulin and overproducing testosterone or androgens from the ovaries, but we also produce androgen hormones from the adrenal glands. And stress can stimulate the overproduction of those hormones, and we can experience dysregulated periods and all of these classic PCOS symptoms that I mentioned. So, stress is a huge factor. And my take on this too is Certainly, if there's stressors we can control or modify, amazing. But there are a lot of things that maybe aren't in our control, and we have to show up at work for that number of hours, and we have kids at home and different life stressors going on. But are there ways that we can even improve the body's stress resilience? Can we support the body with adequate nourishment and added minerals and really supportive blood sugar and support our sleep and a well-rounded movement routine and things that can really improve that resilience in the body to stress versus throwing gasoline on the fire?
There's so much that you can control, like what we put in our mouth and those
Yes.
kind of things. Yeah, for sure.
Yeah.
So, why should somebody stop fixating on like cutting carbs to treat insulin resistance? Because I hear that a lot. And then,
Yeah.
like, instead, like, why should they focus on the cellular health? What's your opinion on that?
I love that question. And ultimately, my take on this, my feeling is that and I want to acknowledge too, everyone is unique in terms of their nutritional needs and their carbohydrate needs, but the blanket recommendation in our system is go low carb or cut out carbs for blood sugar issues. But ultimately, we're not getting at the root of the problem and we are missing the forest for the trees because maybe we minimize bigger blood sugar spikes if we're not producing as much insulin after a meal. However, our cells are still resistant to insulin. And what we see in practice a lot too is women are under eating carbohydrates. And we know that blood sugar crashes and dips in low blood sugar is incredibly stressful on the body and is going to stimulate the production of stress hormones. So we want to find that sweet spot or that balance. So our approach with clients in terms of supporting blood sugar is how do we one improve cellular insulin sensitivity? How do we get our cells to better respond to that insulin and to utilize energy from food better? And then two, how can we eat and live and support the body in a way that will really elongate the blood sugar curve and support slow rolling hills with blood sugar throughout the day versus
Right.
these big peaks and crashes. And that often involves incorporating carbohydrates into our meals so we have that adequate energy to support the body, to support our hormones, our thyroid. But let's think about carb quality, right? Can we choose
Right.
slow burning carbohydrates and carbohydrates that are richer, more rich in fiber, our whole food carbs? Can we pair that carbohydrate source with great quality protein and lots of non-starchy veggies and healthy fats and things that help to really stabilize blood sugar and slow down the digestion of those sugars? We really see the super low carb approaches actually making things worse for women in practice. Again, by really putting a lot of stress on the body, we see again a lot of fatigue and sugar cravings and moodiness, and we have a lot more success with women focusing on the true blood sugar balance or regulation, optimal nourishment, and then focusing on that cellular insulin sensitivity.
Yeah, I love that, and it just takes you back to the core, like, the root of the problem. That's where you've got to fix it ultimately, if you want it to last, if you don't want that Band-Aid approach, so
Right.
I agree with that. So, you mentioned too, like, just our stress and sleep and how, our society, like, women don't get enough sleep these days, and we don't either as mamas, but goals, but what are your recommendations for aligning your body's natural circadian rhythm to help with PCOS and alleviate insulin resistance and inflammation, gut issues? What's your take on that?
Yeah. So circadian rhythms, I think, are so overlooked as an area to support for women's health, women's hormones, gut health as a whole, and particularly with PCOS, where there are these metabolic pieces and imbalances that women are often experiencing. And ultimately, at the end of the day, the kind of easiest way to put it is everything in the body is circadian. Circadian rhythms refers to that like roughly 24-hour cycle that all of our internal biological processes operate on. And our circadian rhythms are influenced by a few core external factors. These factors basically help to make sure that things are happening in the right place at the right time. The big things I would focus on for supporting circadian rhythms would be a consistent bedtime and a consistent wake time as much as possible. Those
Yep.
are really great anchors for the body and signals for the brain that support synchronization with our circadian rhythms. The other big one I would mention is light regulation, which I think is a biggie for most of us. where ideally to support circadian rhythms, we want to get some light exposure soon after waking in the morning. Absorbing that sunlight into our eyes is what actually stimulates the production of hormones and supports thyroid hormone conversion. It supports
Mhm.
blood sugar regulation and insulin and a healthy stress response. Ideally, getting a little bit more sunlight midday if possible. In the evening, the big thing that we want to consider is aiming to reduce exposure to blue light and a lot of artificial light, which
Mm.
confuses the brain and disrupts the body and our hormonal systems. I have to like briefly share this little study that was done. I think it's a little older from like 2012, but basically this study took a group of healthy individuals that had healthy metabolic parameters, so like healthy glucose and fasting insulin, all of that, and took this group and disrupted their circadian rhythms for 3 weeks by keeping them up later and exposing them to artificial light at night. At the end of 3 weeks, this group of individuals that was previously healthy, stable there, had pre-diabetic fasting levels of glucose and insulin and experienced over an 8% decrease in their metabolic rate, their metabolism, without changing anything with their food. They basically stayed up later and they were exposed to bright artificial light at night. And
Crazy.
after normal habits, all of these biomarkers that I mentioned resolved or normalized, which is also really cool and encouraging in terms of are there
There's
some
hope. There's
yeah, there's
hope.
hope and art, but I think it highlights the point too that I think food and nutrition is so important, but I think sometimes we get overly fixated on what we eat and we
Yeah.
forget that staying up late and doom scrolling on our phone with blue light 10 inches away from our eyes is
Yeah.
not helping the cause. So in the
Right.
evening, can we dim the overhead lights or turn off the big overhead lights and put on some table lamps or floor lamps? Can we dedicate 30 minutes of like screen free time before bed and maybe we read or relax or do
Yeah.
something calming away from screens? If we absolutely have to be on screens in the evening, can we throw on a pair of like blue light blockers to
Right.
filter out some of that blue light? These things sound small, but they make a huge difference over time with supporting our hormonal health and specifically in terms of PCOS with supporting the thyroid, supporting our hormones, supporting our insulin sensitivity.
And you mentioned like everything in our bodies on a circadian rhythm, even like our gut bacteria, right?
Yes.
So you're less likely to have gut issues if you can regulate your body to be on a circadian rhythm.
100.
That's it's, but I like how you mentioned it too. Like you can't do just great nutrition. Like it's really a holistic approach. Like you've got to move your body, you've got to work on your stress, how you utilize your stress and transform it and approach that, how you do eat, how you sleep. Like you're not I don't know. I see people sometimes who are like, "I'm gonna just start eating better and see how that works." And while I do hope that there would be some improvement there, you're really, like, cutting yourself short and just not doing yourself any justice. Either help yourself or not. Go all in and really embrace this holistic lifestyle to balance your hormones, to balance your thyroid out, to help your gut health. Just inflammation is such a driver for all of these things, and it's just like everything we're talking about right now, like you could not explain to somebody in just a 5-minute wellness visit. It's really unfortunate, but
I know.
there's so much to it. There's so much to being healthy, but it's this is how God made our bodies. This is how it is supposed to operate. Like he didn't make us to have to be on 20 different pills. Like Jesus didn't take 20 different pills. I don't know. It just
And and to your point too, in terms of how we're made, I think a lot of this is like getting back to our roots, right? Like eating real food, getting outside and getting exposure to the sun, going
Right.
to bed when it's getting dark out and minimizing the screens, moving our
Yeah.
bodies versus being sedentary all day long. So a lot of it is getting back to our roots to help support our bodies in recalibrating.
Exactly, just resetting everything. Yes. Like, we are so resilient and, like, our bodies know what they're doing. They are so smart. And so, I think by putting so much medication in there, like I said, not against it, but when you're just suppressing all these symptoms, like, you're basically telling your body to shut up. Shut up. You
Yeah.
don't know what you're talking about. I don't wanna hear it. And
Yeah.
it's like your body is screaming for help. Listen to it and embrace it and just your body knows what it's doing.
It
It
does.
knows what it's doing.
And I love that you mentioned that. We always tell clients symptoms are really a way that your body communicates with you.
Mhm.
And if we can listen and tune in, I know it can feel frustrating. We've both been there in the trenches, but if we can listen and lean in and start to make adjustments and even just take imperfect action with some of the things we're talking about today, the body will respond. And to your point, is so incredibly resilient. We see that day in and day out with clients. To your point too, with medications, it's like it's like the check engine light is on and we're just like turning the button off, right? And continuing to drive.
And for me, for example, every time I ate anything, my stomach hurt for as long as I can remember. And I thought that was completely normal. And so for me to start to tune in and listen to my body and say, okay, what does this mean? That was hard. That's not easy
Yeah.
because I didn't know any different. But once I actually took a holistic approach and just said, okay, you know what? I have nothing left to lose. Like, I feel terrible living right now with the way my body's working. It was like it could finally be free and do what it needed to do if I just moved out of the way and let it do its thing. But it can be hard to do. It's not easy by any means, but there are just so many things that are normalized that can go on and that you think are normal, but it's really just becoming so much more aware of your body. And yeah,
Yeah,
this was a
I couldn't
great
agree more.
conversation. This was
I know this
great.
is so fun. I feel like clearly we could talk about this endlessly, which is amazing.
Yes, yes. Jillian, is there anything else that you wanna leave our listeners with? I just love how you have talked about PCOS and just put everything out there. It's so common, and people just need to hear it. Women need to hear it. Guys, if your ladies have PCOS, let them hear it other ways.
Yes. Yeah, and I think honestly we covered everything so well and got to touch on just like so many important things today, which I really appreciate. And I think my last sort of message would be if you're currently struggling, you're in the trenches, know that there is so much opportunity for you. And I'd encourage you to find the right support. If your current provider isn't working for you, find another one. And you deserve to feel amazing. You don't deserve to feel suboptimal. And it's possible to get there, even though it might not feel like that. But there's so much opportunity for you to really get to a place where you feel amazing in your body.
Yeah, for sure. It's totally possible. Jillian, thank you so much for being here today. This
Thank
was
you for
so
having
much
me.
fun. Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.